Good evening. Welcome to OC Health Matters OC, Your Health Matters OC. My name is Dr. Clayton Cham. With me, my co-host, Dr. Chinseo Kwan, um, otherwise known as Dr. CK. And because she is the new health officer now going on week number 2, I'm going to ask her to start with COVID information first before we go to our guest today. And for those of you who are watching and if you have questions, the topic today is colorectal cancer. So please send us question at yourhealthmatters@ochca.com. So you can communicate with us by submitting question to yourhealthmatters@ochca.com. So let us start with Dr. CK first. Dr. CK, what is the state of the COVID today?
Good news is our numbers continue to decline. Our case rate for COVID here in the county is down to 3.7 per 100,000. And there's only 126 individuals who are hospitalized with COVID, and 25 are currently in the ICU. We are continuing to make small progress in vaccination rates, with now over 2,443,437 who received their vaccines, and 1,222,416 who received either a booster or additional shot. And 36% of our kids age 5 to 11 received at least one dose, and those who are age 12 to 17 received, 73% received at least one dose. And our older population is doing the best, right, with 100% of our 65 and older receiving at least one dose. In terms of deaths, we continue, unfortunately, to see deaths. And right now we have 6,846 who have passed away from COVID. That's all I have.
Yeah, I think that one of the perception is that we are on the way out of the pandemic. I wanted our audience to really know that other part of the world, they're rising in cases right now, right? Particularly in Europe, some countries in Europe, and in Asia. I know I've just spoken to my uncles who live in Hong Kong and my aunt. The cases in Hong Kong is, I think, one of the highest rate now in the world. And so they're struggling with that typical scenario that we've seen here during the surge, and that is too many people die, funeral home is not able to, and the hospital is not able to contain the body. So they're using container refrigeration, and people are just not able to hold whatever cremation that the family wished to do, and that has been postponed. And cases of elderly getting into the hospital, I think it's like 90% now. 90% of their cases in the hospital are individuals over the age of 60. So I'm really grateful that in Orange County, our senior 100% have seen one dose. But again, I really want our senior to know that you are eligible for the booster vaccine. Please get your booster dose. And then for those who are immunocompromised, you can get your 4th dose. Please schedule and get it, okay? Right. So one question that I know everybody want to know, what is the situation of the hospitalized for the kids?
There's 10 kids who are hospitalized with COVID and 0 in the ICU for today.
That's great news.
But I just want to make sure people realize that even though we may not have a mask mandate, in our county, it's still very important for everyone to continue to use precaution. We hear in the news of this new stealth variant, BA.2, which is a subvariant of Omicron. It's more transmissible than the original Omicron, and it can still affect us even if we have low counts. And we know that our low counts are not reflective of how much illness is in our community, because more people are actually testing with home kits and are not reporting it. Okay. So really, again, what we learned in the science of BA.2 is that the most protected are those who are fully vaccinated and boosted.
Okay.
So get your booster shot.
Yeah. So get your booster shot, get tested if you have symptoms or you're exposed, and really wear a mask appropriately. We have been talking to you about assessing your own risk and do the right thing for you and for your loved one. Okay. So COVID milestone, um, where are we at in terms of death rate? Did you mention that
Yes,
number?
I did.
Yeah, you did. Okay, okay.
6,000.
So let us get now to the topic for this show, colorectal cancer, because March is Colorectal Cancer Month, and we are fortunate to have our guest with you, Dr. Patrick Koo from St. Jude Heritage Medical Group. Join us here. Thank you so much, Dr. Koo.
Thank you for having me.
Can you introduce yourself and talk about your role at St. Jude's Heritage as well as your specialty, Dr. Koo?
Sure. I'm Dr. Patrick Koo. I'm a attending physician, gastroenterologist at Providence St. Jude Heritage Medical Group. I specialize in gastroenterology, which is the study of disorders of the digestive tract, which includes disorders of the esophagus, stomach, intestines, liver, gallbladder, and pancreas.
Thank you. I'm so grateful that you joined us today to talk to our public about this topic. Now, as far as I know, every year there's about approximately 52,000 Americans die from colorectal cancer. What are the statistics that you can share with us to make sure that our public is aware?
Yeah, so 52,000 people die each year in the U.S. from colon cancer. About 150,000 new cases of colon cancer are diagnosed each year as well. When you combine men and women, it's the third most common cause of cancer in the U.S. and worldwide.
Wow.
And it's important to understand it's actually one of the most preventable types of cancer as well.
Okay. So in, I think, March of 2021 or May of 2021, the U.S. Preventive Services Task Force has made a change in their recommendation. Can you talk to us about that?
Correct, yeah. So, I mean, in general, to date, most of the societies have always urged colon cancer screening for the average risk adult to start at 50. But actually, as we have seen more and more younger patients below 50 get diagnosed with colon cancer, then more research has been shown to support earlier screening. So actually about 10% of colon cancer is diagnosed in patients under the age of 50. And actually the incidence of colon cancer in younger patients below 50 has actually been rising over the years. So taken all together, because it is such a preventable type of cancer, the new recommendation is to actually start colon cancer for all average risk adults at 45 rather than 50. Yeah.
So that was a significant change, right? I mean, that means that a whole lot more people. I know we issued a press release last year when the U.S. Preventive Services Task Force changed the recommendation to our colleague here in the community.
Mm-hmm.
But one of our viewers, Mary, sent in the question, and this has to do with risk, right? So Mary said, my grandmother died of colon cancer. Does that automatically make me high risk? So can you address Mary's question and also other type of risks?
Sure, yeah. In general, when we assess risk in terms of family history, we're typically referring to a first-degree relative, okay? And so in general, unless there was a pattern of colon cancer in one side of the family, in general, a grandparent typically would not necessarily confer a significant increased risk to that individual. But certainly if there was a first-degree relative or if there clearly was a pattern on one side of the family, then that would certainly be different. Yeah.
So first degree meaning parents?
Parents, siblings, or even children, yeah.
Okay, okay. And then what are other risks associated with colorectal cancer?
Yeah, so there are certainly in addition to family history and genetic hereditary conditions that run in the family, that certainly would be another risk factor. Patients who have a personal history of either precancerous polyps, that certainly would make them at higher risk and they would need to be screened more regularly than the standard every 10-year interval, but also patients with inflammatory bowel disease such as Crohn's disease or ulcerative colitis, especially if it's been long-standing, that also predisposes to risk for colon cancer. Those would be the main. I mean, there are going to be, more rare cases. So in patients who have had pediatric cancers and have had abdominal radiation, there can be some increased risk there as well. But I would say in general, the higher risk patients are going to be linked to family history or potential genetic conditions in a family predisposing to colon cancer, or those with personal history of precancerous polyps or personal history of inflammatory bowel disease.
Okay. And I know when I go to my primary care physician, she reminds me all the time, right? Are you exercising? Are you smoking, alcohol, drinking, and watch your weight and all that stuff? Even though I don't have a family history of colorectal cancer, but I know she's very good with that, and I get screening all the time. Talk about prevention from an integrated medicine perspective. I know you're big with that, and you work with folks who work in the integrative
Right.
setting and approach. What would folks in that setting advise their patients?
Well, typically we want to talk about your risk factors, your family and personal risk factors, but we also tend to focus more on lifestyle because there's a lot of lifestyle that contributes to cancer, right? So as you said, if you're obese, if you're sedentary, you're not exercising, you're eating a poor diet, or the standard American diet, or we call SAD American diet. With the standard American diet, people are barely getting 5 servings of vegetables or 2 servings of fruit, and they're not exercising. It's really inflammatory. It's a lot of red meat, and red meat causes a lot of inflammation. Alcohol causes injury to the GI tract and significantly increases your cancer risk. And there's a lot of processed foods, lots of carbs that all contribute to cancer risk. So whenever someone asks me, what should I do if I have significant family history aside from screening and getting my colonoscopy? The next thing I say is, okay, let's get started on the basics. Where are you at with exercise? Let's at least get a little bit more active. If you're eating, I want you to eat the rainbow. So I want you to hit every single color throughout the day. And that makes it easier for people because people don't like to stick to the numbers. If you really want to know, I want you to eat 5 servings of vegetables. And by 5 servings, I'm saying a fistful, or, a fistful is a serving. So how many of us have had 5 servings a day, right?
I'm afraid to raise my hand.
And at least 2 servings of fruit. And why the color of the rainbow? Each color provides a lot of wonderful nutrients and different nutrients. So you can get a lot of vitamin C with orange or orange-colored products, or vitamin A. And then berries are really important when it comes to cancer prevention because they're full of antioxidants. In terms of the leafy greens, I know that we have a lot of lettuce, and a lot of people eat their hamburgers with lettuce and tomatoes, and that's the only vegetable that they get. But when you're looking at the leafy greens, you really want the more sturdy greens, the more bitter greens. So arugula, kale, cilantro, parsley, mix it up, right? You want to eat all those green leafy vegetables because they provide the fiber to help you have a regular bowel movement, but they also provide a lot of nutrients that help your body heal. And I think of the gut lining like the skin, but on the inside. So it's just like when you're protecting your skin from sun rays and sun damage, you want to make sure that it's hydrated. You want to make sure you're wearing your sunscreen and wearing, protective clothing, same on the inside. You want to eat foods that are not inflammatory, that can calm the GI system. And so when people want more specifics, then we talk about turmeric or different herbs that help reduce inflammation. And so curcumin or turmeric is really wonderful. It comes from, actually a lot of Asian cultures use it in their cooking, and it has properties that really reduce inflammation on the gut. Now, those herbs and supplements that you may hear from specialists, they're not for everyone, and you really have to be monitored by a specialist. And if you're going to go into the supplement world, you have to take high quality supplements. So it should be monitored by a provider who's an expert in that. And also with herbs, there's interaction with medications. And if you do have cancer, you really need to talk to your oncologist to make sure whatever you're deciding to do when it comes to herbs and other nutrients is going to be okay with whatever medication or treatments that you have with your oncologist. That's where I would start, but there's a whole other world in the integrative field that I love to talk to. The other thing I didn't mention, fish, omega-3 fatty acids, those are nice and calming and also help reduce inflammation.
Dr. Ko, there's some statistic that talk about the differences in terms of cases of specifically colorectal cancer, and 1990 is the year mark that they talk about. And can you talk a little bit about that, Dr. Ko?
Yeah, so essentially, we're basically seeing patients in this generation. We're gonna expect to see higher and higher incidence in colon cancer compared to maybe a generation ago. And while the exact reasoning is complex, I mean, a lot of it really is felt to be related to lifestyle. Okay, so with increases in obesity or increases in diabetes, processed food consumption, red meat consumption, and increased use of alcohol and tobacco, that's probably contributing to a lot of the increased incidence in colon cancer in this more recent generation.
Yeah, so Dr. CK mentioned earlier about the different in diet, and I know before the show we were just talking about the different type of diet that are related to culture. I know my mom's watching, so she has this idea that I eat very spicy because of my ethnic background, and so she's always warned me, don't eat too spicy because you're going to have cancer of the stomach and the colon and what have you. So, Mom, if you're watching, Dr. Koo is going to dispel that myth or confirm that myth. So, Dr. Koo?
Yeah, I don't believe that there are any specific associations with the spiciness level and cancer risk. I think really the more risk is with either smoked or preserved foods or very charred, barbecue type foods, and that has been associated with increased risks of cancer. Yeah.
So I mean, there's certain ethnic groups that are really their diet include a lot of smoked,
right,
kind of food, right, from meat to vegetables. So you saying that those are the type of food that people have to pay attention to, right?
Yes. Yeah.
So screening, how do you screen? What do you screen now? So walk us through the different type of screening.
So yeah, in general, there are multiple ways to screen for colon cancer. They're certainly all going to have their pros and cons. But if you want to think about it simply, they're going to be your stool-based screening tests and then what we call your direct visualization screening tests. So with regards to stool tests, mainly they're broken down to tests that detect blood in the stool. So that would be the fecal occult blood test or the FIT test. And then there are newer tests these days that actually check for DNA. So these are stool DNA tests that assess for any DNA that's shed from the lining of a cancer. Okay, so those are going to be the stool-based tests. In general, they're certainly going to be easier to perform than a colonoscopy or a procedural type of test. They do need to be performed more frequently, so oftentimes they are annual. But I think the important thing to understand is, number one, they're not perfect, okay? So they can actually miss 35% of cancers and actually potentially lead to a delayed diagnosis, okay? And they don't have any preventative aspect to them, okay? Meaning they're only detecting either blood or DNA shed when it may have kind of been progressed a little bit further down the line versus a colonoscopy, okay? So a colonoscopy is the gold standard for colon cancer screening only because you're taking a direct look into the colon, okay? So your rate of missing a cancer is going to be much, much lower than a stool-based test. But then number two, it really has the ability to prevent colon cancer, okay? And that's because colon cancer isn't typically going to appear out of nowhere, okay? You're not going to go from a normal, healthy intestine to cancer immediately. It takes very slow pre-cancerous stages and typically over years to progress, okay? And so that's the important reason why we screen everybody now 45 and above, because we want to not necessarily only catch the people who already have cancer, but we want to catch polyps or precancerous tissue when they're still in the precancerous stage. Because of colonoscopy, we have the ability to actually remove this precancerous tissue. And if you actually remove the precancerous tissue, you don't allow it to keep progressing, okay? And in that way, regular routine screening colonoscopies can actually prevent someone from developing cancer. And obviously that, to me, is the better way to go. You know?
So in the same procedure, if you are able to see a polyp, then that polyp will be taken out right away, the same procedure?
Exactly, yes. I would say for the vast majority of polyps, we can remove them all during the same procedure. And in that way, that's where the prevention comes into play. You know?
Yeah, I know Catherine sent us a set of questions and asked about the prepping for the colonoscopy. And her question is it true that people have to take 3 days off and all of that? And what are the new prepping alternative solution that we have currently? But before you address that, I know I can't convince people that colonoscopy is not painful, but there's that myth as well that it's painful procedure.
Right.
So let's hear from you. Is it painful? Is it not painful? Or is it that I didn't feel it because I was completely out, so I wasn't aware of the pain?
Right. In general, it is a very, very well tolerated procedure, and in general, it is not a painful procedure. The vast majority of patients who undergo colonoscopies, they do have some form of sedation. So whether it be what we call moderate sedation, or there are some patients that need a deeper level of sedation for medical comorbidities. But in general, it's a safe, short procedure that is not painful, and there's no significant recovery from it. The main recovery is really just waking up from the sedation, and patients, you know, walk out the door into their cars on their own. Yeah.
Okay, so let's address Catherine's question about the prepping.
Right. Yeah, prepping is a part of the procedure, and in general, it's probably the part of the procedure that people dislike the most, okay? That being said, I think it's not as bad as people think, okay? So the reason why doing a bowel preparation is important is the colon is where we house all our stool, okay? So for us to be able to give a good examination, we need to cleanse all of the stool out of the body, okay? And so typically how that's done is the day before, we ask people just to adhere to a clear liquid diet. So they don't have to fast completely, but you would avoid any solid food or any sort of liquids that you can't see through. So everything has to be clear liquids. And typically late afternoon or early evening, that's when we start the bowel preparation, which is typically a combination of various types of laxatives. And there are, a whole wide range of brands of laxatives that can be used. I think historically, some brands were less pleasant than others, but there's actually many, many options these days. Even ways you can, mix up your own bowel preparation that are much, much more tolerable. Okay, and because you don't need to start the bowel preparation until early evening, our patients are going to work the day before, just adhering to the clear liquid diet. Okay, and starting the bowel preparation when they get home from work the day before. Now, of course, the day of the procedure, because the vast majority of patients are sedated, okay, they're going to need to take that day off just because they may be drowsy and sleepy from the sedation, okay? But then the day afterwards, you're back to normal, back to driving, back to work.
Great. We talk a bit about the risk factor and the lifestyle. And one of the questions that I've always heard people talk about is that, well, what does weight have to do with colon cancer, right? I mean, smoking and alcohol, we understand that, right? And eating food that preserved, we understand that. But what does weight have to do with colon cancer?
Yeah, it's been associated with higher risks of colon cancer. Whether or not there's a causation there, I mean, research will have to still research that. But certainly, when we look at who is getting colon cancer, we do see an association with more colon cancer found in obese patients or the obese population. Yeah.
Okay. And then the preventive side, exercise, is that related to controlling your weight? Is that why exercise is recommended?
Yeah, so similarly, patients with decreased physical activity, that has also been associated to be a risk factor for developing colon cancer too. And it goes hand in hand, okay? So the more active someone is, the more weight loss they may achieve. That probably in combination will help decrease risks of colon cancer.
And so we know that, third cause of cancer in both men and women, right? Mm-hmm. Is there a differential risk for different ethnic group? Okay.
Yes. Yeah, so African Americans are at higher risk than Caucasians, okay? And so it's about a 20 to 25% increased risk for African Americans in terms of their colon cancer risk. So even before these new updated guidelines recommending screening for all ages 45 and over, African Americans had already been recommended to start their screening earlier already. Okay, so previously it was African Americans should come in at 45 years of age, but in general now it's kind of a general guideline to all adults aged 45 and over.
What about other ethnic group like the Asian and Native American and Alaskan?
Yeah, Native Americans
Latinx
and Alaskans. Right? Yes, they also have an increased risk of colon cancer as well.
Okay. What about folks with the Hispanic origin, the Latinx community? Is there an increased risk in that group as well, or no?
As far as I know, that has not, there's no specific guideline in the past that was recommending earlier screening. As far as I know, typically it was African Americans coming in at 45.
So from an integrated perspective and encouraging people to keep up with their screening, how do you educate the community, especially, vulnerable community? If I'm poor and I'm busy, I have multiple jobs, you know, how are you going to convince me that that is one of the priority that I have to pay attention to?
I think first finding the priority of the individual and the family. So once you find out what drives them to do whatever, you know, to live life, then you use that to help you make the case for getting screening. And most of the time, people want to be there for their family, for their loved ones, for their kids, support their family. And in order to do that, you have to be healthy. You can't be in the hospital. You can't be going on, you know, undergoing cancer treatments. But to be healthy, it's better to screen than wait to have symptoms, because once you have symptoms, it's just too late. So typically I use that to help any patient with any condition to make a change. What is important to you first and foremost, and let's use that as your guide to get through what we need to get through to prevent. And I agree that the colorectal cancer is one of those cancers as the most preventable, right? Many other cancers, we hear a lot of things, but by the time it's diagnosed, you know, you're already going down the path of treatment. But if you screen early enough with colorectal cancer, you can actually, like you said, remove the polyp and screen more frequently. You know, I had the unfortunate experience of having a family member, not first degree, but a family member who was unfortunately diagnosed with late-stage cancer, colorectal cancer, and it was a couple of years after deciding not to screen when they were supposed to be screening. And, you know, we had all hoped that, and we always think back, well, what if a couple years back before the diagnosis, they actually went through the screening? Maybe, you know, they'd be alive today. But, you know, hopefully viewers out there who are listening are taking this seriously and getting screened. In that situation, I think it was a wake-up call for all of us. You always think that it won't affect you or your family, so I come from Asian heritage, and so we always think we're healthy, but in all due respects, when our culture comes to the United States, we have all the habits, like the sedentary habits, eating a whole lot of meat, a lot of processed foods, and that increases our risk significantly compared to if we were to come from our native country. And I think that reigns true today, right? Like when you have different generations moving from their original native country to America, their incidence of cancers, cardiovascular disease rise significantly. I think it has to do with lifestyle. That's just a little bit of my side. And I mean, luckily that family member, so at the time that he was diagnosed, he unfortunately was given 6 months to live, and that was very difficult. But we talked about everything that he could do while he was waiting to undergo cancer treatments. And he was really aggressive about changing his diet from an all-meat diet to one that was full of vegetables. And at the time I was telling him, just steam your vegetables, don't char it. He was hydrating. He was also making sure that his mental health was in check. And I think that's also very important. When anyone is diagnosed with cancer, they need to find some way to be calm despite the chaos.
We'll talk about that in a second in the treatment. I'm going to ask you specifically that question.
So yeah, the good news about his case, cleaned up his diet, lifestyle, was more in touch with himself, was calm, was able to spend more time with family, did go through all the cancer treatments and oncology, was visiting and part of many different studies, and was able to extend that 6-month period to well over 5 years. I think it was actually 7 years. So there is hope, but there's a lot of steps that you need to do to really heal your body through that process.
In case you just tune in, this is Your Health Matters OC. I am Dr. Clayton Chow. With me is my co-host, Dr. CK. And today our topic of the conversations is colorectal cancer, because March is the colorectal cancer month. With us, welcome Dr. Patrick Koo from the St. Jude Heritage Medical Group, part of the Providence Health System. Dr. Koo, how many of your patients show up to see you, and really what portion of them are people who never have any screening, or people, even though they have screening, but they show up with colorectal cancer?
Yeah, I would say the vast majority of patients who undergo colon cancer screening with a colonoscopy do not have colon cancer. Okay.
Okay.
So I would say the majority either have a normal colonoscopy or they have some precancerous polyps. Certainly, we do see patients who on their index, so their first colonoscopy with 0 symptoms, they are found to have a colon cancer. Sometimes it's in such an early stage where we can actually remove the whole cancer at the time of the colonoscopy because it's still in the polyp itself, okay? And in that sense, they've essentially potentially been cured from colon cancer. But if it's an early stage, then we typically will send them for surgical resection. And if it's caught early enough, maybe chemotherapy may not even be required, okay? So we certainly see that as well. And I think that goes to show that colon cancer can be present without any symptoms, okay? And I would say the vast majority of colon cancer in the early stages has 0 symptoms. By the time it's causing symptoms, for instance, blood in the stool, changes in bowel movements, abdominal pain, typically that would mean that it's progressed to a more advanced stage. And so when I hear patients say, well, I don't feel like I need a colonoscopy because I've never noticed any blood in the stool, I feel totally fine. I think it's really important to understand that in the early stages, you will have no symptoms. And that goes again to show the importance of screening, because we never know who is going to develop cancer or precancerous polyps or have a totally normal colon, but if we screen everybody, then we're able to pick things up.
So the most important message up to now is that you don't necessarily have to have symptoms to have the presence of the cancer, right? So that speaks to the importance of the screening that we all talked about earlier. So let us tackle treatments. What are some of the options? I think you mentioned that 90% treatment can prolong people's life, right? If you catch it on
Right.
early. But so what are the options for treatment, Dr. Koo?
Sure. So with any sort of cancer treatment, specifically colon cancer too, it all depends on the stage, okay? So if it's caught in an early stage, meaning the cancer is isolated either in the polyp itself, okay, or if it has not spread outside of the intestine, then the goal will be to cure the person of cancer, okay? And that can be done either by taking out the cancerous polyp on a colonoscopy or sending for a surgical resection, so sending to a surgeon where they can surgically remove the tumor by essentially, making a cut above where the tumor is and below, taking out the tumor and then reconnecting the intestine. That would typically be if there is no evidence of spread outside. At the onset of any cancer diagnosis, we typically are performing what we call staging scans. So we'll usually in the form of CT scans to check the lungs, check the rest of the abdominal organs to see if there's any focus of spread of cancer outside. If there is spread outside of the intestine, then in general, the treatments would be more with chemotherapy, okay? And that's through the care of an oncologist or a cancer doctor to prescribe a specific medical therapy to help treat the tumor.
Okay. So you just said earlier briefly about the importance of your mental health stage. And so beside that, what is the treatment regimen beside the chemotherapy. I think you kind of alluded to lifestyle changes, yeah? Get more specific about that, CK.
So I think, so the stress plays a huge role when it comes to cancer, right? Like, you need to get adequate sleep, and you need to, again, keep your stress and your anxiety level about the situation in check, because otherwise, what I've seen at least, and this is anecdotal from my patients, when they are really stressed out, there's just almost no healing that happens. Like, the treatments don't work as well, and they just go down a path much more quickly. And I think there's a lot of endorphins, there's a lot of good things that happen in your body when you're able to mentally have a sound mind and also be connected, whatever spirituality you have or belief that you have, to be connected with that too, because it keeps you grounded. Because just going through all the treatments is very stressful, all the different appointments, you're stressed about, well, what if, how bad is this? And you almost have to take a deep breath and just be thankful for where you're at, be grateful for the connections you have with your family, and surround yourself with family and love to get through the next couple of days or months or years. And I think I've seen the ones who have been most successful are the ones, again, who strengthen their relationships, strengthen their connection with their spiritual beliefs, and also remain calm through the entire experience.
So typically at St. Jude Heritage, Dr. Koo, if somebody come in to see you with a diagnosis of colorectal cancer, obviously it's you and the surgeon and the oncologist. What other discipline that you have in your treatment team to support the patient and their family?
Yeah, so typically on the oncology side of things, they certainly have nurses specialized to manage their cancer patients. We have palliative care teams as well to help alleviate a lot of the symptoms that can either go along with the cancer itself or the treatments of cancer. And so it's not just the individual physicians, but there's a big team of ancillary staff as well that's there to support the patient in their journey. Yeah.
And a lot of family and patient that I talk to, this fear about having to wear a colostomy, right? So can you clarify with us in what cases would somebody need to wear a colostomy?
Sure.
Okay.
Yeah, so typically speaking, colostomy bags are needed when you don't have the ability to reconnect the intestine back. So I would say probably one of the more common scenarios is if someone has a rectal cancer, meaning the very end of the large intestine near where it connects to the anus or the anal verge. If the tumor is very, very low, then there's a greater chance that someone might need a colostomy, because if you take out the tumor with surgery, you may not have the margin below where the tumor is at to reconnect things. Okay, so that would probably be a common scenario. Now, another scenario would be if someone were to present with an obstruction, okay, where obviously it would be a later stage where the tumor has grown so large that it has blocked off the intestinal lumen, okay. In those cases, someone might need a temporary colostomy bag and then get reconnected sometime down the line.
Okay. So obviously colon is part of our digestive system, right? And so if somebody has part of their colon taken out, what do they look for? What do they have to look for? What symptom will they have? And what kind of diet changes that do they need to follow?
Right. So there's two kinds of intestines. So there's the small intestine and the large intestine. Okay, I would say patients that have part of their large intestine removed, for the most part, it doesn't really affect their lives as much, only because the main function of the colon is for water absorption. So if you just have a part of the intestine, of the large intestine removed, usually your day-to-day and your bowel movements probably are not that much different. Now, it's different if someone needed their entire large intestine removed, then certainly they would expect more frequent bowel movements because the colon isn't there to resorb a lot of the water. But I would say in terms of colon cancer, if someone needed what we call a partial colon resection after surgery and after being reconnected, they essentially go back to how they were previously. Yeah.
Yeah. There's a support group for family. I mean, sorry if you don't mind sharing. You kind of alluded to that it was pretty stressful for your relatives' family. I mean, immediate family, right? So,
Right.
talk about support groups and all that for family. What should family members need to look out for, and what do they need to get for themselves in order to provide the support that the individual patient would need?
So depending on the system and the healthcare, so there's a lot of great healthcare systems we're surrounded by here in Orange County. And for the most part, when someone has a significant cancer, there's a lot of support groups for the patient themselves, as well as the family members. There's a lot of respite care. There's group visits also with other cancer patients, because there's a lot of healing also with just hearing about someone else who's in the same shoes that you're in and is going through the same process that you're going to be going through. On the religious side, if you have a religious background, it's, again, very important to also have that connection with whichever religion you believe in. And then when you get home from all the tiring chemotherapy, radiation, it's nice to have family there to help you through the toughest times, because sometimes the toughest times are at home when you have all those symptoms, the nausea, the vomiting, the weakness, the tiredness, the pain. And having loving family members that can help assist you with just getting in and out of bed, helping you with your meal prep, or just getting you from appointment to home and just traveling in different places really makes a difference. And if you don't have family members, there's other support systems that can provide that for you. And again, we're social beings, just like we said through COVID, we're social beings, and being social and being connected with others is part of healing. And being isolated can actually make any condition worse. And so again, very important for you to feel very connected to your loved ones, to your community, and also to make sure you maintain the communication with your care team.
And I know some hospital, and even in some community, there's supports for family as well, right? So
Right.
That's the piece that I think is very important as well.
Right.
Especially for, I don't know if you've seen this, especially for family member of young patient, right? Unexpected. So what does St. Jude Heritage have for those family members?
I believe they also have a lot of support staff from the oncology side to help support not only the patient, but helping the entire family get through this process. Yeah.
Yeah. So
And I didn't mention there's other treatment options to also help for cancer patients. And I actually, St. Jude Mission, a lot of cancer institutes also have integrative services such as acupuncture. A lot of our cancer patients get a lot of benefit from acupuncture. And I used to do a little bit of acupuncture myself, and what I see with patients is they just feel that peace, that calm, and also it can take away some of the pain. So, look into those services or ask your provider if there's services that can benefit. And then also these cancer treatment centers also have nutritionists and dietitians, registered dietitians that can also help you through the different dietary needs that may change because of chemotherapy or radiation, but they can also be a little bit more on the preventive side to assist. And there's other things, massage and alternative therapies, naturopathic medicine can also provide a lot of support.
That's very helpful.
Yeah.
So, Dr. Koo, this last 2 years during the pandemics, and we went through a lot of period of lockdown, and we know in general people did not go to their primary care as often that they should. What did you see?
Right. Yeah. I think certainly in the beginning, where the whole healthcare system was strained, and there were cancellations of elective procedures and surgeries. So certainly there was an aspect of decreased elective procedures. But I think since then, we still, probably less so now, but definitely in the beginning, there was a fear of going to the doctor. Okay, there was a fear of getting a procedure, even when procedures were back open and happening, for the fear of potentially contracting COVID from either a healthcare provider or a neighboring patient. But I think what I would say when I tell my patients is there are very rigorous screening protocols for all patients before their procedures. So 48 hours before, every patient that is going to get a colonoscopy or any procedure does need to be screened and confirmed negative. Okay. Number
For
two,
COVID.
for COVID, yes. Number two, all healthcare workers and physicians have been vaccinated and boosted, and we all wear the proper protective equipment with N95 masks, and all other patients are also wearing masks, when they're in the endoscopy center. Okay, and so there are many, many safeguards to make the screening process as safe as possible. Yeah.
So did you see a significant number of people who delay the colonoscopy, delay the screening process?
Yes, we had seen patients cancel their colonoscopies, presumably again because of the pandemic. Okay. We haven't necessarily seen a significant increase, at least not in my practice yet, of patients that have developed later stages of cancer because of delay. But certainly that is the fear, okay? Because again, colon cancer is preventable. So our fear is, let's say somebody 2 years ago had a precancerous polyp, okay, and they delayed their colonoscopy a couple years and then a couple more years because of the pandemic. And now what was once in the precancer stage now progressed to colon cancer. Certainly that is what we hope doesn't happen, but with time and delays in screening, certainly that is possible. Yeah.
Thank you. Thank you so much, Dr. Koo. I think we're going to show you contact information for Dr. Koo now. I want to let you know that this conversation, I hope you find it very helpful. Thank you so much, Dr. Koo, and thank you, St. Jude Heritage, for allowing you time to come and spend with us. I know you're very busy. So I hope people get the message that, number one, it is more common than people think, right? It's a third leading cancer cause for both men and women. You really have multiple risk factors to develop colorectal cancer. Just because you don't have a family history doesn't mean that you don't need screening. I think that's one of the things that I've heard people in delaying screening because their reason is, well, I don't have anyone in my family have colon cancer or anything like that for me to worry. So that's not true. And then the other thing that is pretty common is people will say, well, I don't have any symptom that cause concern. And you've heard Dr. Cruz said, you don't have to have symptom to have early stage cancer. And so it speaks to the importance of getting screened, because early treatment have much better outcome, much better outcome. And I know we are in year 3 of the pandemic now, and people are still afraid to go to the doctor because of fear of contracting COVID. So that means that you should be updated with your vaccine. And I still say it, that's the only way to help it to get out of this pandemic. And you really need to follow your recommendation. If you're 45 years and older, really need to get screened, right? Can't stress the importance of that. Thank you, Dr. Koo, for joining us. And folks, you have Dr. Koo contact information if you need further consultation with Dr. Koo, or you want to meet with Dr. Koo, give him a call, give his office a call. Hopefully this has been a very, very good conversation. What would be your advice, the number one most important advice, Dr. Koo, to the public?
Yeah, for me as a physician, prevention is key. So anything you can prevent, that's always going to be so much better than waiting for something to develop. And again, I mean, we can't say it enough. Colon cancer is preventable in the vast majority of cases, and with regular screening, it's something on the order of 90% of colon cancer cases can actually be avoided. And so with a 30-minute procedure that is safe and not painful, and if normal, just once every 10 years, I think that's a small in comparison to potentially facing, cancer treatment. So I think, about 4% of Americans in their lifetime will unfortunately develop colon cancer. Okay, and so knowing that and knowing how easily it could be prevented, I think that continues to stress the importance of staying up to date on regular colon cancer screening. Yeah.
Thank you, Dr. Koo. That's great advice. So if you care about your friend, if you care about your family, share with them this YouTube video on this session on colorectal cancer. So in 2 weeks, we'll see you back in 2 weeks at the same time, Tuesday evening, and our topic for the next show would be on public health, particularly paying attention to food, restaurant, and how do we as public health professionals ensure that the public has clean and safe food consumption, right? It's related to eating healthy, so we're going to address that, but we're going to also talk to you and share with you how we regulate the food industry in Orange County, to be specific. So thank you so much for joining us. Your Health Matters OC. This is a show that run every other Tuesday by myself and Dr. Chow and Dr. CK. Between now and then, if you have questions about public health and about restaurant regulation, about food safety, send us an email, yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. So thank you for joining us today, and we'll see you next time. Thank you.